Faso, communicable maternal, neonatal, and nutritional disorders such as malaria, lower respiratory infections, diarrheal illnesses, stroke, birth complications, health disease, and meningitis are the leading burdens of disease. After reviewing the burden of disease in Burkina Faso and analyzing the top causes of death, we focused and prioritized three major public health issues, which are providing proper nutrition to prevent diarrheal illnesses, delivering vaccines that could prevent respiratory illnesses like pneumonia and communicable diseases like malaria, and improving the quality of water in Burkina Faso so that airborne diseases are prevented.
Therefore, our first recommendation is the Ministry of Health further cooperate with organizations like the World Health Organization, the Center for Disease Control and Prevention, and the Gavi Alliance to aid the development and delivery of vaccines. Vaccines are an important tool in the eradication diseases. They have been successful in eradicating smallpox and reduce the prevalence of measles. Vaccine could aid the people in Burkina Faso in alleviating the presence of meningitis, diarrheal illnesses, as well as malaria. However, countries like Burkina Faso have trouble in attaining vaccines because of their cost, as well as the difficulty in administering them because of the lack of trained healthcare workers. All three of these organizations currently have programs in place to assist countries with attaining and administering vaccines. This would be greatly beneficial to Burkina Faso as it would help overcome the issue of insufficient storage capacities for vaccines and trained healthcare workers. Moreover, cooperations with these organizations would allow for a rapid administration of vaccines to the population, as well as reduce the financial capital that would be required if Burkina Faso were to unilaterally set up vaccination program.
Secondly, we recommend that Burkina Faso address the issue of polluted drinking water by acquiring and distributing clean water technologies that purify household drinking water. Much of the drinking water used in Burkina Faso is sourced from polluted lakes and rivers. The toxins present in these waters contribute to the spread of diarrheal and waterborne illnesses like malaria. There are several organizations that aim to distribute clean water technologies to countries. The most easy to use and affordable are Aquatas, which are purification tablets that can be used to clean household water. These tablets could be distributed to the population for them to use before drinking water or using it to cook. We also recommend partnering with organizations to drill wells, build sand dams, and establish rainwater catchment systems. The implementation of these recommendations will result in the rapid reduction of diarrheal illnesses if water quality is improved, as poor water quality is a significant contributor to diarrheal illnesses. Reducing diarrheal illnesses would cause child and adult mortality rates to decrease. Children are more susceptible to dirty water as their immune systems are not strong enough to fight the germs and viruses found in dirty water. If water quality is improved, child mortality would experience a greater decline, especially when coupled with improvements in nutrition intake.
Our third recommendation is for Burkina Faso to request assistance from organizations that offers nutritional assistance such as the World Food Program, the World Health Organization, and UNICEF. Undernutrition can lead to many diseases such as malaria and diarrhea, and is a significant risk factor during pregnancy because if women do not receive proper nutrition, they, along with the child, are at a greater risk of complications that can lead to fetal growth restriction, stunting, vitamin A and zinc deficiency, as well as death. We would also recommend that Burkina Faso work with foreign governments like the Canadian government to attain fortified seed and GMOs, which have a greater density of nutrients and can withstand the flooding and drought that is occurring in Burkina Faso. Furthermore, we would also recommend securing agricultural technology so that the farming practices can be improved in order to increase a greater output of crops. Cooperating with these organizations and foreign governments would result in alleviation of the food shortage that has resulted in widespread undernutrition in the country. Enacting both of these recommendations would greatly impact child and maternal health, as children would have the proper nutrients for healthy growing. Furthermore, diarrhea caused by undernutrition would greatly be reduced, which is the second leading cause of death in Burkina Faso. Burkina Faso is unable to satisfy the need of basic health care of its population, and it is recommended that they work with the organizations to improve health care and lessen the burden of disease.